pregnancy is confirmed by a phase of amenorrhea, that is absence of period, and a pregnancy test is done either the pregnancy duration is 40 weeks. The earlier problems in the first trimester are Hello everyone, I am Dr. Rugmini, Senior Obstetrician Gynecologist, Bewell Hospital, Poonamalle. Today I am going to discuss the various phases during a pregnancy. As you all know, the pregnancy spans into 360, duration is 40 weeks and it is divided into 3 trimesters like first trimester, second trimester and third trimester. First we will see what is called first trimester. The duration of the pregnancy from the last menstrual period to up to 12 weeks of pregnancy is called the first trimester. During this period, usually the pregnancy is confirmed by a phase of amenorrhea, that is absence of period, and a pregnancy test is done either using a urine sample or the blood sample. So, usually the pregnancy is confirmed by 5 to 6 weeks. The earlier problems in the first trimester are the patient may have excess vomiting and urinary tract infection and antepartum hemorrhage, that is bleeding from the uterus. So, we will go to the each problem now. Because of the pregnancy hormones, the lady will be feeling lot of the urge to vomit, and usually it happens in the morning, or for some ladies it can happen, the vomiting can be there throughout the day. So, usually when the patient comes for the antenatal checkup in the first trimester, which is scheduled like every 1 month, in the first visit, after checking the vitals, the patient is asked to take an ultrasound scan, which is called a dating scan. It will confirm the pregnancy and the viability of the baby. After that, the patient is given folic acid tablet, and if there is vomiting, the tablets are prescribed for the vomiting also. Another problem in the first trimester is the urinary tract infection. Because of the urinary tract is very close to the uterus, the urinary symptoms are very common for this in the first trimester, like burning during micturition, increased frequency, etc. So, urine sample is checked, and if there is an infection present, it is treated with antibiotics which are safe in pregnancy. And the third problem, which is like abnormal bleeding in the first trimester. So, it is a cause of alarm. So, usually an ultrasound is done to see whether the baby and the placenta, everything is fine. So, if there is a viable fetus and the fetus is growing normally, the patient is asked to take rest and some extra medication is given to keep the pregnancy safe. So, now we will go to the third. During the first trimester, we do the basic blood investigation for the ladies, like their blood group, hemoglobin level, serology test and the urine test, and thyroid function, blood sugar, etc. Now, coming to the second trimester, which extend from the 13 weeks to the 28th week. This time also the pregnant lady is seen every 1 month, that is up to 28 weeks. The injection, tetanus toxoid injection is given in the late first trimester or in the second trimester. Along with this, in India, we prescribe iron and calcium tablets along with the folic acid. This time the baby is growing faster, so the mother has to take care of her diet. So, she is prescribed how to take diet pattern, how to follow that. If her blood sugar levels are high or showing any abnormality, we are advising her accordingly. And the problems usually we see in the second trimester are urinary infection, and sometimes the baby's growth may be affected, and some problems related to placenta like bleeding and all that, and sometimes some ladies will get preterm labor pain. So according to their problem we treat this according to the patient problem. So coming to the third trimester, this is the time which extends from 29th week up to 40 weeks. 40 weeks we call as term, and most of the delivery happen around the 40 weeks, either 1 week prior to the 40 weeks or 1 week after the 40 weeks. And so the problems in the third trimester are mainly related to the baby, like the baby's growth, sometimes movement may reduce, the fluid surrounding the baby may be reduced. All this has to be taken care of. In third trimester we see the pregnant lady very frequently, like up to from 29th week up to the 36 weeks we see them every 2 weeks. During this time also iron, calcium and the vitamin tablets are prescribed, and the growth of the baby is monitored very closely. And if they are developing any symptoms of preterm labor pain or any other issues like infection or anything, this is treated. Usually they come in the third trimester, that is the last around 38 weeks. We do an internal examination, and depending on the ultrasound findings and the clinical findings we can give an idea whether this patient will go for a normal delivery or may end up in an instrumental delivery or cesarean section. So this is in a nutshell how we do the antenatal checkup in different trimesters. So today I have discussed very basic information regarding the different trimesters of pregnancy, and in the coming sessions we will discuss about each trimester and the various problems in that more exclusively. And I hope this video is helpful to you. Thank you.